area here where you can see in the orange, that's ages 10 through 19. So I think that's kind of an interesting figure. And then these two counties over here, in the yellow are age 50 to 59. For some reason, they're kind of grouped in that area. So just kind of interesting to see how the numbers are tallying as far as across the state for positive testing. Switching over to influenza, we continue to monitor the influenza surveillance, and you can see here that Nebraska is in the green or the minimal range, so that's good for this time of year. That's kind of what we would expect. However, Puerto Rico continues to have high numbers, so just kind of interesting to see across the United States, where the numbers are lying, and it looks like farther south we have it seems like a little bit more incidence here. Okay, as far as the state of Nebraska, the weekly influenza rate numbers are relatively low. Two Rivers District here, 2.1. So I know most of them are zeros. So I think, as far as flu goes, we're just not in the season right now, but we continue to monitor and make sure that we know what's going on in our area as far as influenza. We left this screen up from last time. This is just talking about the COVID data tracker, and it's just talking about the immunizations. And the immunization schedule has changed so much, so we just have to just look at our little cheat sheets to be able to tell what to give people. And the children have their own immunization schedule. Theirs are different than the adults, and so there's nothing straight across the board. You just have to just look at what age your child is and then what vaccines are available for him as far as COVID vaccines. They're all, they've got different dosages and different frequencies. And so just when you call, we'll just tell you, where your child lies in that immunization schedule, because it really varies. So just call and double check with one of us nurses to be able to help you to find what vaccine is available for your child. As I said, we have National Women's Health Month this month. And so we really want to emphasize, taking care of yourself and the other women that are involved in your life. There's a special week, May 8th through 14th is Women's Health Week. And so just think about prioritizing your health. And it's not only physical, but it's the mental aspect as well. It's never been more important. This time of year, we've just been through a COVID pandemic. We're just kind of recovering from that. So we've put ourselves on the back burner for the last few years. And so now we need to focus on our health and our wellness and make sure that we're doing the things that we need to do to keep ourselves healthy as well. During the Health and Wellness Week, it has some information here on just encouraging women and girls to reflect on their own individual health needs and taking steps to improve the overall health. Think about those underlying health conditions. Do a double check on hypertension, diabetes, obesity, cardiovascular and respiratory conditions. And women over 65 and older need to really focus on, being healthy and living a healthy lifestyle. You can see here on the next page, it's pretty busy, and I just kind of clipped this kind of from the middle section of some whole page of health and wellness tips, especially emphasizing physical and mental aspect of staying well. Of course, you need to keep that active lifestyle, 150 minutes every week, and you can break that down into parts. It all counts. So just, if you can go for 15 minutes or 30 minutes walk during your lunch break, that all counts towards that 150 minutes. And of course, strength training is really, really important to make sure you exercise those other muscles, like in your arms and shoulders and just your upper body strength. Nourishing your body inside and out, eating those balanced meals is really important now more than ever. So just, trying to really think about, what you put in your body is going to just be able to help it to maintain your strength and durability. You can see in the second column here, it's talking more about the mental aspect, but it's really important to connect with your community. Make sure you're connecting with your friends. Make sure you're just make a phone call. If you're feeling down and out, just make a phone call and talk to somebody else that's maybe in your same life space. And just, it just really helps to be able to verbalize, how you're feeling inside. Managing your stress, you've got all kinds of indications here for things that you can do for stress, as far as meditation, yoga, reading. Any of those things are going to be able to help you to calm yourself down and just help you to relieve your own anxiety. You help others, but I think working on ourselves is probably the last thing on the list as far as what we do in our everyday living. And now we have a special presentation. Dr. Beecham has decided that she would join us this morning. She's got a special broadcast, and so we're going to let her be able to enlighten our lives with all of her knowledge that she's going to share with us this morning. So Dr. Beecham, please go ahead.
Hi, Rita. You're very kind. Rita, would you be able to turn on my video? It looks like maybe you need to turn it on. But in any case, I am so glad to be here. And I know I've not been on all these calls lately, but it's so nice to be back. And Rita, just to hear your kind words about the great nurses who work at the health department and such good work that you guys are doing all the time. Thank you. Let's see if I can turn this on. Hey, there we go. All right. So one of my roles as medical director is to also kind of help to talk to clinicians and hospitals in our area about sort of what we're seeing clinically in the region in terms of what's been reported. So this doesn't fit all that well with the women's health theme, but I do want to talk about tuberculosis. And so TB is actually something that we're seeing a little bit in the district, and we're following some cases. And so I just wanted to take a minute to remind people a little bit about kind of what TB is, why it's hard to diagnose and treat, and kind of what we do at the health department, and how you can be vigilant among your own patient population about diagnosing this kind of tricky to find disease. So Rita, is that okay if I talk for a few minutes on this?
Of course.
I'm going to assume that's a yes. All right. So first of all, tuberculosis, it is very old. It has been found in archaeological sites from over 5,000 years ago on multiple continents. This thing has been with us for a long time. Why? So TB has some very interesting traits that have allowed it to really be very successful over time and within the human body. And when I mean successful, I mean bad for us. The cell wall of tuberculosis is really different than a lot of other things. It's called Mycobacterium tuberculi, and the mycobacteria come from mycolic acids, which are in the cell wall of tuberculosis. The other thing about tuberculosis is that it is very slow growing. E. coli can double in 20 minutes. Tuberculosis takes 20 hours to double. So this is an incredibly slow growing organism, but once it gets going, it's bad. Untreated tuberculosis may be 50% fatal, according to the WHO. So not good news. Fortunately, there is treatment, but because of its long latency, it's sometimes hard to pick up. And because of its unique structure, it can be difficult to treat. So the first thing is, who do you suspect TB on? So tuberculosis is primary pulmonary. 85% of people who have TB have it in their lungs, but 15% of people who have TB have it elsewhere. It can be in any organ: brain, skin, lymphatic system, bones, joints, genital TB. TB can do whatever it wants. This is why historically it's been called the great imitator, because lots of things can be TB. This is why, as a clinician, you have to be really suspicious and test for TB if you're concerned about it. So who are people who might be at risk for TB? First of all, people who were born in a country that has tuberculosis, people who work and live in kind of congregate settings. We think about people who are in jail, people who may work in factories with a lot of people. Also, people who live in a household with somebody who has TB. If you have a household contact of TB, 30 to 50% of the time, other household contacts will acquire tuberculosis. So at the health department, whenever we find a case, we're really interested in who else lives at the house, who else might be associated with that case. And for those of you in the community, think about where do they work? Is there anybody else they know with a chronic cough? That kind of thing. So most people do present with a chronic cough. Over 3 weeks, over 4 weeks, start thinking about getting a chest x-ray, start thinking about tuberculosis, hemoptysis, fatigue, weight loss, very nonspecific symptoms, okay? So there's two things. I think TB is a little bit tricky because when we're taught about it, I think it gets kind of, we don't do a whole lot of TB education. So the first thing about TB is, does a person have TB? And the second thing is that TB active or latent? And the third thing is kind of, where is the TB? So first of all, diagnosing TB. We often think of the TB skin test, and this is where they inject a little bit of protein from the tuberculosis. Your immune system reacts with it, and it can tell you if you've been exposed to any one of the members of the tuberculosis, the mycobacteria family. The problem with this is that there's a vaccine that's used outside of the United States for tuberculosis called the BCG vaccine that uses a cousin of the mycobacteria, and the tuberculosis skin test will cross-react with that. So for people who have maybe been exposed to TB or have had a BCG vaccine, they may come up positive on that tuberculin skin test. The second type of test is a blood test. We draw the blood, look at the T cells, expose them to the tuberculosis, and see how much interferon they release. This tells you if the body has seen it before, positive, or not seen it before, a negative test. These are called the quantiferon gold or the TB spot. You'll hear those kind of names. So the next question is this TB active or latent? Latent TB is where the body forms an immune cell granuloma around the tubercular organism and doesn't let it circulate, doesn't let you be infectious to others. Active TB, when it either gets out of the granuloma or a granuloma never contains it in the first place, and then the TB is circulating and somebody can cough and be infectious. Now, with COVID, we were really concerned at the beginning, could it be airborne like TB? We eventually decided that COVID was primarily droplet transmission, but airborne transmission is bad news because it means by breathing and coughing, people can get it in their lungs pretty easily. So if you breathe in tuberculosis, for most people, the body will contain it and it will become latent TB. That's about over 90%. But for about 10% of people, the TB is never contained. So within 2 years, 10% of people who are exposed to TB will have active tuberculosis. It takes that long because it's very slow growing, right? And the others will have latent TB. And the problem with latent TB is that itself can activate later on if you become immunosuppressed, if some other situations happen. Sometimes we don't know exactly why. But to reduce the risk of that, we treat latent TB, and also because we know active TB is actively infectious to others, we definitely treat active TB. So let me just give you a quick rundown of how we do that. So latent TB, again, they're not infectious. The TB is held within a granuloma or a tubercula. That's where the name comes from. With those patients, we try to treat them with isoniazid or rifampicin, and it's a long treatment, 6 to 9 months. These are for asymptomatic latent TB cases. And generally, that's good enough. The isoniazid interferes with that cell wall I talked about. The rifampicin keeps the DNA from sort of multiplying. Usually that's enough. It's not always a cure, but it reduces your risk of activation of TB by 60 to 90%. So a pretty good treatment. Now, for active TB, it's an even more intense treatment. You're often on 4 drugs for multiple months. And TB is also so flexible and so able to have drug resistance that we think it's really important to even watch people directly and make sure they take the medicine. How many other antibiotics do we actually observe the treatment? None except TB. But it is so important from a public health perspective to control these TB active cases that one of the functions of the health department is to help with the directly observed treatment or DOT therapy for tuberculosis. And that means that when we have active TB cases in our area, we are sending staff out to go and make sure that people take it. Sometimes we can do it by video, but it is a public health imperative to get those cases treated. This is also why I wanted to talk to you today. Identifying these cases can be very tricky. TB is the great imitator. It can do lots of different things. We just have to have a high index of suspicion. As rural America becomes more racially, ethnically diverse, we have immigrants, we have people working in congregate settings. We need to be thinking about this and testing for it. So again, long latency can develop slowly. Testing the quantiferon or the interferon assays are good, even if people have been vaccinated. Otherwise, you can do the PPD skin test if people are relatively low risk. And treatment is a long time. If you have questions, if you're concerned, contact us at the health department. We think about TB, we're interested in it, to make sure that it stays at bay. So Rita, thank you very much for letting me give a quick spiel about TB. And for those of you who are clinicians or working at hospitals on the call, this would be a good opportunity just to remind your team, hey, I was on the health department call and they're talking about TB. Are we thinking about that? Because chances are, at least for me clinically, it's not always that close to my mind. So a warning that it is around here, and we need to be finding it as much as it finds us. Thanks so much.
That was so awesome. Thank you so much, Dr. Beecham. That was very, very informative. I learned a lot from that. Thank you.
It's a fascinating disease. I
It
mean,
is.
unfortunately, it knows a lot about us. So
While we have Dr. Beecham here, is there anyone that has any questions for Dr. Beecham?
I'm just glad to be here. And anyone can always contact me by email or telephone or through the health department. We are here to help as much as we can.
Okay. All right. Well, thank you so much.
Thank you. Rita, you may be muted. We're not hearing anything.
Okay. Yeah, we've got it unmuted here.
Much better. Great.
And okay. Yeah, and we'll go ahead and continue here. We're just rearranging our screens here, so just kind of bear with us here. Oh.
Dr. Beecham, can you give us host back?
Maybe. I'm not sure how to do it. Let's see. How about I just sign off? Will that give it to you?
No, I got it.
Okay. Looks like you're back on. Thanks, guys.
Again, thank you so much, Dr. Beecham. Okay, now we're going to switch over back to the health department here, and we just wanted to share some information about the dental screenings for this year. The Lifestyles program has been very successful. This is for this the 0 to 4 age group, and so they're completing their final clinics for the school year on Wednesday of this week. They've had a total of 51 dental clinics this past school year, and they're now scheduling the fall dental clinics with the schools. The dental program has completed 2,775 dental screenings. So I think that is just really phenomenal for our area. They are looking for area dentists to send some referrals to. And if anyone feels like they have some information, they can share that with Vaughn if they have any questions. His number is posted here as well. COVID testing has taken a change as of April 30th. The COVID testing has been dissolved here at Two Rivers due to the federal ending of the public health emergency on May 11th. So no longer able to do testing here. However, you can still use the testing kits and we have a limited supply. I think we got a new shipment in of some that we can hand out here at the health department, but it's kind of, if you need some kits, it would be best to get them and have them on hand, just so you don't run out when you need some. The event calendar, we've posted the different clinics that we're having. You can see twice like every week we have a clinic on either Monday or Thursday, and we've got also our other outreach clinics in Cozad and Lexington and so forth. This is the calendar that we have scheduled. The monthly Buffalo County Fairgrounds clinic is now moved to the main office from 5 to 7 on the last Monday of the month. So just to kind of be aware that that is a change. The COVID-19 shots are available by appointment only. Are there any questions on anything that we've talked about earlier today? Anything that anybody wants to share or has to comment? You can see here we have a picture of a mother and her two daughters. And so I want to emphasize how important it is to keep those family connections. It's really important to make sure that your loved ones are not isolated, and they are able to speak and share. Make sure you go and see your mom this weekend because it's Mother's Day and you want to share that time with her while you can. So please go out and do that and enjoy your mom. Anything else? Okay, with that, I think we'll go ahead and close our presentation for today. Thank you so much for being able to share some time with us.